Hi, I'm Michele Johnson, Chief Nursing Officer at Advent Health Fish Memorial. Banyan was introduced by our Chief Nursing Executive around the time post-COVID, really looking at ways to enhance the models of care that we were able to provide, knowing the challenges that came out of workforce post-pandemic. And so did some research on the product and really wanted to look at how we could bring that type of innovation into our nursing practice. Our experience with Banyan has been very positive. The interactions with our partnership and being able to collaborate with the leadership team of Banyan as well as the project managers on site have allowed us to have a successful implementation and pilot rollout. We have virtual nursing in 2 units right now at our hospital, one in our emergency department and one on our PCU floors. We use it to supplement the workload intensity for our nurses, allowing our RNs to function at top of license. So that is the reason we brought virtual nursing in, is to really look at how can we complement and reduce that workload for our team. In the emergency setting, it's focused a lot on medication history and general admission data assessments, which then feeds into the inpatient unit. So anybody that comes out of the emergency room as an admission is ready to go to the floor, and that saves a task for the inpatient nurse when they're getting their admissions from the emergency room. The staff feedback has been overwhelmingly positive. If you ask the emergency room nurses, they've been very happy with the help and benefit of the medication history, as well as the constant observation, allowing them to move more freely to other patients focused on top of license care. It's also allowed them the opportunity to spend more time in the patient chart, which I know that seems counterintuitive, but the reality is they're allowed to do more comprehensive review of their patients because now they have the time to do that. If you ask the inpatient nurses what's been the most helpful for them, one is receiving the emergency room admissions with the general admission data forms complete, as well as the discharge planning component, really helping to give more comprehensive and timely discharge education. I believe there's a lot more that we can optimize going forward that will continue to just enhance the benefits for our nursing team and really focus on reducing that workload intensity. Overall, I haven't had any patients that didn't like it. They like the additional support. They like knowing someone's there timely so they can get an immediate response. Overall, from a patient experience perspective, we've seen a couple of areas of improvement with care and concern being met, timely response, staff responsiveness, things like that. So overall, I feel like it's been overwhelmingly positive from the patients as well. I would say early findings so far have been around staff responsiveness, patient satisfaction areas, as well as incremental overtime reduced at the end of shift, enhanced misdocumentation opportunities have been resolved, so we have less misdocumentation opportunities, as well as, I would say, potential to mirror with the virtual patient observation of having reduced falls. We intentionally picked a unit that had opportunities in some of our outcomes, and we've seen some early wins in that space. It is my goal to implement virtual nursing in most of my units across the organization. My first attempt would be to enhance the pilot in the emergency room and be fully complemented in that space. Because what I do know from there is if all general admission data forms are done on every ED admission, then our inpatient nurses win as well. And so really looking forward to that, as well as the med history being accurate from the start allows no delay in care and the right care getting started at the first point of entry.